In this video, you'll get a quick overview of the dairy zoomer test. I'll explain the vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. The dairy zoomer detects IgA and IgG antibodies to peptide-level antigens in cow's milk dairy and also includes dairy IgE levels. In other words, it's a food sensitivity test assessing for reactivity at the peptide level. Peptides are short chains of amino acids, typically 2 to 50 of them, linked by peptide bonds. Note, a longer chain, 51 or more amino acids, is called a polypeptide. In contrast, proteins are made from one or more polypeptides folded into three-dimensional shapes. These large, complex molecules play many important roles in the body, from red blood cells to enzymes to muscles. Food sensitivity testing measures reactivity to whole, undigested, three-dimensional proteins. Since proteins exist in aqueous, aka watery environments, reactivity to whole proteins is predominantly to the outer, water-soluble portions of those proteins. In contrast, food zoomer testing, like the dairy zoomer, measures reactivity to the small, typically not water-soluble, two-dimensional peptides created when whole proteins are digested into smaller fragments. Note, antibodies to peptide fragments will not recognize or bind whole, three-dimensional proteins and vice versa. To learn more, check out the peptide versus whole protein handout in your provider portal. Vibrant Dairy Zoomer is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of one antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and dice the wafers into tiny microchips. Then arrange the microchips, one for each antigen, in a 4x4 or 10x10 grid atop one pillar on a 24 or 96 pillar plate. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers for minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have three options: summary, interpretation, and all markers. I'll be going over the report that includes all three options combined, as it is the most comprehensive. Let's start with a quick overview. The Dairy Zoomer sample report includes a cover page, introduction, summary with interpretation, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it explains how the Dairy Zoomer summary score is calculated, using a unified score calculated from the IgE, IgA, and IgG reactivity to the respective antigens, with higher weightage for IgE than IgA than IgG. As well as the part where it says, reference ranges have been established using 2,000 healthy individuals. And also goes on to explain, the classification of green denotes result that is within the normal reference range, the classification of yellow denotes result that is moderately elevated with respect to the reference range, and the classification of red denotes result that is elevated with respect to the normal reference range. The summary starts with the milk score. Note, this patient has a high score of 4.7, and then lists all elevated and moderately elevated results along with an interpretive comment. And the full report lists the levels of all markers, including dairy IgE, and note this patient is not allergic to dairy, as well as casein peptides like kappa-casein, beta-casein, and beta-casomorphine, and whey peptides like beta-lactoglobulin, serum albumin, and lactoferrin. The dairy zoomer also measures reactivity to butyrophilin, a milk fat globule membrane protein. The IgA and IgG antibody levels are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. If you want to learn more about markers that are outside of the reference range, you can scroll back to the summary and read the interpretive comment. For example, retinal S antigen is one of the most potent uveitigenic antigens. I once had a client with uveitis. The client invested in dairy zoomer testing. Results showed high reactivity to the alpha S2 casein and retinal S antigen overlap peptide here. And when they eliminated dairy from their diet, their uveitis resolved. No more eye inflammation. So, which patients benefit most from this test? Well, patients complaining of eye irritation or other inflammatory conditions like atopic dermatitis, eczema, or other rashes. Also, GI symptoms like gas, bloating, and abdominal pain during or after meals. Other ENT symptoms like recurring ear infections, runny nose, and mucus-filled cough, or patients with other food sensitivities or allergies. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the dairy zoomer, consider a food zoomer bundle to assess for immune reactions to peptides in other commonly consumed foods, such as the corn zoomer, egg zoomer, grain zoomer, lectin zoomer, nut zoomer, peanut zoomer, soy zoomer, and wheat zoomer. Also, the food allergy panel to assess IgE immune reactions to 12 of the most common food allergens. And note that if this test is ordered, the results will populate alongside food zoomer results. And also the gut zoomer to assess for gastrointestinal imbalances that may potentially increase the risk for food sensitivities. And finally, total immunoglobulins to evaluate baseline levels of total IgA, IgG, IgE, and IgM. Serology testing is based on normal functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, the dairy zoomer uses highly specific and sensitive microarray methodology to measure IgG and IgA antibodies to peptides in cow's milk dairy, and also includes dairy IgE, providing in-depth assessment of dairy sensitivity and allergy. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.